We are back with Cone Health's Dr. Cynthia Snider. She's answering your questions about COVID-19. All right, so this question is about someone who goes to get their COVID test, right? But they're waiting for days. It's now been 5 days since they got tested. Their symptoms are gone. Do they still need to isolate?
So you should, if someone's getting tested for symptoms, and you're in that waiting period, you're doing the right thing. You're staying home, you're laying low out of, you're not trying to infect anybody, and you're wearing a mask when you're in public if you have to go out. If you're presuming you're positive, your isolation should be like it's 1 day. It's like your onset of your symptoms plus 5 days. So on that 6th day, if you are feeling better, and presumably if your symptoms are all gone, you can go out in public and resume back to work with the new CDC guidelines. But the key caveat is you have to ensure that you're wearing your mask throughout your workday and doing errands and such.
Okay, and if you didn't have any symptoms whatsoever, ever, but you tested positive, or you tested and you haven't gotten it back yet and it's 5 days,
the same applies. You should wear a mask for those remaining 5 days.
All right, well, let's talk about that. What mask should I wear?
Over these last couple of years, we've gained so much information about masking. And, initially it was fabric masks. We needed 2 layers. And then you could also use like surgical masks. And then there was also either the KN95s or KF94s, all these different higher filtrations. With Omicron being so infectious, we're finding out that fabric masks are not enough. We feel that the fabric masks, they come in all different fabrics. They probably have if you can breathe through it, you can probably feel your air, and that just means it's not efficient enough. So it's very important to get either like these types of the paper masks, and then you making sure it's tightly around your nose as well as the bottom of your chin, so that you don't feel like extra air blowing through it. And if you have access to the KN95 ones, those 2 are actually probably provide the best filtration for the public.
Okay, but let's talk about those fabric masks, because I know I have a whole bunch of them. A lot of them are kind of 2-ply. They have like an opening in the middle. So I have heard that you can put like a coffee filter in there, and that will help with the barrier.
Correct. So if you probably doubled up the barrier, that would give you a better efficacy to that mask. And again, a regular paper mask like this is considered about 65% effective. But if you make it tighter, be it twisting the straps around your ears like that, you can increase the efficacy up to like 75%.
Okay.
So it's just making sure that your mask is covering your nose and below your chin, and not like this per se.
Right. Okay, we're back to the whole isolation thing. When does my isolation period start? When I test positive or when I feel sick?
So if somebody has no symptoms and is getting tested positive, testing for work purposes or your close contact, the day that you test positive is considered day 0. And your next day is considered day 1. And then you stay under isolation for 5 days. If somebody is getting tested for symptoms, even mild ones such as congestion or I feel like I have allergies, the first day of your symptoms again is considered day 0, and then you stay isolated for 5 days.
Okay, the day you test positive or the day that you start feeling the symptoms.
That's right.
Okay. All right, we're going to take a quick break. We're back with more of your questions coming up next.